Joining us on the phone is Dr. Nasser Bahbahani, Professor of Medicine at Kuwait University and consultant in respiratory medicine at Mubarak Hospital, to elaborate more on the occurrence. Dr. Bahbahani, can you tell us more about the season of viral diseases currently hitting Kuwait?
Well, good afternoon to you and to your viewers. Thanks for asking me to participate. As you stated, there has been an increase in the number of cases which attend primary care centers and the emergency department with the several symptoms related to the respiratory system. This happens actually every year in this time of the year. As you know, viruses, especially influenza virus, has a seasonality to it. So in Kuwait, the season usually starts in September, October, maybe peaks around November, and the case decreases considerably from December further. Why this happening and why this happens? This is the nature of the virus, and it's different from country to another. Hello?
Yes, you're still on the air, doctor.
Yeah. So in Kuwait, maybe the explanation this time of the year, changing from the summer hot weather to a more cooler temperature, and also going to school, because as you know, when children go to school, this is a good medium for transmission of viruses, and this happens almost every year. Of course, there is a different. We divide it in the medicine into a common cold, influenza-like virus, and the pneumonia, which is infection of the lungs itself. And the severity of these things vary a lot of these three conditions that I mentioned.
Dr. Bahbahani, what advice would you give our viewers in terms of health measures against this season?
Well, to start with, there is a sort of common sense advice. If somebody develops these symptoms, at least within the household, they try to avoid as much as possible. For example, covering their nose, getting rid of their the tissues that you use, washing the hands, and among the children, if somebody has fever, it's better not to take him or her to school, because this may help spreading more the disease. And we advise everybody now, all ages, to take the influenza vaccine, because as you know, annually there is a new influenza vaccine becomes available around this time of the year. It gives you protection against at least severe complication that you may get. It may not prevent all kinds of influenza, like illnesses, but at least it gives you a degree of protection. And the second advice, people with chronic conditions, like people with asthma or people with chronic respiratory conditions or other, to take their preventive measures. The people with asthma, they know they have their controller inhalers or preventive inhaler. They should take it, because these viral illnesses may exacerbate the other medical problems that they may have.
Dr. Nasser Bahbahani, Professor of Medicine at Kuwait University and consultant in respiratory medicine at Mubarak Hospital, we appreciate your input and thank you for your time.
Thank you for having me. Thank you.